Hey guys, this is Mark at Optimum Physio, and I just want to talk to you about the hip flexors and why we need to have them lengthened, and need to have them where we stretch them regularly. But oftentimes the hip flexors, they get very tight and they'll start pulling on the lower back. Often, if we look at Tony, I'm going to kind of show you how they run. They're going to start from actually the lower back segments, and they're going to crush your pelvis, and they're going to attach right here to the proximal part of your femur. So you can imagine as this muscle gets tight, they can really put a pull on the lower back and cause it to have a bigger curve. So we need to, as physical therapists, we recognize this, and we know that we need to have a good way of stretching this group of muscles. So let me just show you a series of 3 movements that I do with my patients, and they're very effective and help with taking away back pain. Okay, Tony, so let's go ahead and kind of get on one knee on the mat. Okay, we'll start in this position. The first thing we got to do is put the pelvis in the right position. So we're going to tuck in your pelvis, okay, tuck in the hips. Okay, now from here, Tony's going to put his hands on the mat, right? And then he's going to really try to drive his hips to the mat and really try to keep this pelvis tucked in. And this is isolating the hip flexors. That's the first movement. You do this for about 30 seconds to a minute. The second progression to this would be keeping the position here, but you're moving your elbows to your knees. Okay, you're still keeping the pelvis tucked in, and you're driving the pelvis to the ground. Really, we're really putting more weight here, a more aggressive stretch on the hip flexor. Okay, and then lastly, we're going to come up like last time, keeping the hands on the knee, tucking in the pelvis once again, and then we're going to drive again towards the mat. Okay, each one of these positions you hold for about 30 seconds to a minute, and then you repeat it on the other side. And the only thing you do is just you go ahead and switch it out. Tony, if you can switch it out for me. Okay, we'll go to the first one again. From here, before we even move, we're going to put everything in alignment. Going to tuck in the pelvis. Good. Hands down to the mat. Okay, and we're driving the hips to the ground. Good. And you see here, this is a good example. Here it's pretty aggressive on the knee, so let's go ahead and kick this foot out just a bit more so it's a little easier on the knee. And it also puts more of an aggressive stretch on the hip flexor. Okay. So even looking at Tony, I can tell he has more tightness on his right side than his left. It looks like he's getting a bigger stretch on his left side. Okay, to the second position, we're going to go ahead and come up, put in the elbows on the knees, and we're going to tuck in the pelvis, and then we're going to drive the hips to the ground. Just like that. Now we're getting a good stretch. I don't know if y'all could see that, but he has more flexibility on his left hip flexor than he does on the right. Okay, he holds that for about 30 seconds to a minute, and then here we go. We're going to come off of that, and then he's going to bring his hands here and still tucking in his pelvis, and he's going to drive his hips into the mat again. Good, Tony. Come back up for me, and let's come up to stand nice and easy. Okay, so remember, guys, hip flexors, they connect to your lower back, they crush your pelvis, and they connect here to your femur. If they get tight, they'll put a big pull on your lower back, giving you a more aggressive lower back curve here. And if you stretch these guys out, they'll significantly reduce your lower back pain. Thanks, guys.